Hello, everybody, and thanks for coming to RxSight Ed, an educational session on how doctors all over the country are implementing the light adjustable lens technology. It's short for light adjustable learnings. And I'm joined here today by my friend Dr. Satya Reddy from Louisiana. Dr. Reddy, hi, thanks for joining us.
All right.
Can you tell us a little bit about your practice and the type of practice that you have and when you started to implement the light adjustable lens?
Sure. My practice is a solo practice with two offices, and I've been here since 2009, so I've been open for a while. And it's a cornea slash general practice. It's a high volume of cornea surgery and a good volume of general ophthalmology and cataract surgery as well, including refractive surgery. And I implemented the light adjustable lens into my practice in May of 22.
So you had been looking into the light adjustable lens, and then you were presented the light delivery device. Tell me about the decision making to make that final call to implement that technology.
So once I had a better handle on better understanding of how the system works, then the decision came down to discussing with the office staff how would we implement the system. Everything from the spacing of the light delivery device, working on patient appointments to work with it, and how to basically the logistics of expanding our the practice to incorporate this technology.
That's great. I do want to ask the question about the cost because I think some people think, boy, will it really be worth it? Did you find when you invested in the light delivery device that the cost, the investment was worth it?
Regarding the cost of the light delivery device, when I looked at it as a cost standpoint, I looked at it as the cost of light delivery device. When we compare with most ophthalmic equipment, it's not greatly more than realistically, it's double the price of an OCT, for example, on average. Perhaps it's not grossly so much that it should be really the barrier to entry here, especially considering that the cost of the device, the cost of technology, it's you're paying for technology. And when it compared to an excimer laser or femtosecond laser or many other technologies, it's not any more than any of those technologies. I think a great comparison would be looking at a femtosecond laser. And a femtosecond laser doesn't necessarily improve our outcomes per se, but it is a very big capital expense to a practice.
Can you tell me how the light adjustable lens has affected workflow and efficiency in your practice?
Well, once we started incorporating the light adjustable lens, we definitely had the first 3 months of learning of how to best incorporate these patients into the clinic schedule. One of the implementations was scheduling patients three or four visits ahead of time so they could plan out their post-operative adjustments. So typically, we used to schedule post-op visits at 1 week and then 3 weeks. Now we incorporate that, so we go ahead and schedule the 1 week, then 3 weeks, 5 weeks, 7 weeks, so we can go ahead and account for the schedule to account for the adjustments. And it's that's been the biggest implementation change of planning the schedules further out, so both the office staff and the patient is aware of when the adjustments will get done.
So I understand, Dr. Reddy, you have kind of a different workflow for the light treatments that a patient has after surgery. When are they scheduled throughout the day? And tell me about their workflow in the practice.
Generally, the patients who come in for their light adjustments, they're scheduled. We schedule two in the morning at the start of the clinic, two at the start of the afternoon, and two more in mid morning and mid afternoon. Because once the patient gets here, they get examined, refracted, and then dilated. And so that way, while they're sitting and waiting for that portion, the clinic can keep continue moving on forward. And then they get their treatment and then they get to go. So we try to schedule 2 to 3 at any session in the morning and then mid morning.
Got it. So
Right,
in
right.
total,
Yeah.
in total, you've got basically two at the start of the day, two mid-morning. So eight total, maybe in a day.
Generally speaking, that's correct.
Okay, great. You find that your techs and your optometrists like that workflow?
Yes, after having played the different workflows, we found this to be the most efficient.
Let's talk about a couple of things that I think also can affect the practice. How do you price the light adjustable lens in relationship to other premium technology in your practice? Is it above it? Is it the same? Is it below it?
Initially, when we started, for the first few months, probably the first 3 months, we priced it on parity with other premium technologies in the practice, just to get patients to buy into it, to not look away when they see a higher price. After the first few months, that we had patients who were giving us positive feedback, then we gently increased the prices to account for the extra workflow in the practice.
Okay, that's great. And how much more than other premium technologies is your light adjustable lens price?
The price premium is roughly 15 to 20% more than other premium technologies.
Yeah, that's great. So I mean, in that way, it is some additional work, but there's an opportunity to have an economic upside for that work.
Yeah, there is. There is. The reality is that there is a marginal economic upside. There is additional work. The biggest benefit comes from patients who are much happier and much happier with the additional with the visits and the adjustments.
So I've heard you say that your patients are much happier, and that's really the upside. Tell me in what ways you hear that they're happier with the process.
The patients go through the process. The patients need to be educated on the front end and are educated on the front end that this is a process. It's very similar to getting a custom made suit or a custom made dress. And we remind patients it's just anything custom takes time and effort on both the patient's part as well as the surgeon's part. And the patients understand that as they go through the process, they're going to hit an endpoint that they choose and that they can hit their goals. So from that standpoint, patient education and once patients buy into the process, we don't have any complaints about the process. So and at the end point, the patients end up extremely happy, even more so when they talk to their friends who might have had lesser technologies and complain about, well, this is good enough, but. And with the patient with LAL, we don't hear the I'm good, but. It's just I'm good, I'm happy. So that's really the biggest advantage we have here.
Well, I want to applaud you for that because a lot of folks, I think, when they first hear about the technology, they might think that the workflow would be a reason to not do it. But you're saying, basically that when they're properly educated about it, that they get to participate in the workflow actually makes them happier at the end, plus a superior outcome. I mean, is that your kind of summary?
Absolutely. Many patients are used to participating in workflow. If we think about it, any patient who goes to a house remodel, any patient who's ever had a clothing made, and many patients may have that. It may have been many years ago when they got married and had a wedding dress made, perhaps. But once patients understand they get to participate in the outcomes here, they they don't complain about that. They actually look forward to it. There can be a bit of excitement and buzz because we tell them either you can buy a shirt off the rack and just learn how to be happy with it, or we can help you get to the point you're happy with the vision and help you get there. So patients do seem to buy in, and we don't have any complaints about patients saying that this is taking a long time.
Has the light adjustable lens grown your business overall? Yes or no? And with the answer, tell us how.
The being the first provider of the light adjustable lens in my market has definitely created more buzz in the practice, and people are coming in to learn about the light adjustable lens, even those who haven't chosen to proceed with the technology. So there's definitely been an increase in overall patient volumes through the doors just having the technology itself.
Yeah. And do you receive a lot of doctor referrals? Do you work closely with primary eye care providers like optometrists in your market?
I actually, again, being the first in the market with the light adjustable lens, I've actually picked up quite a few referrals from both optometrists, some of those who didn't refer to me in the past, as well as other ophthalmologists who have some excitement about having this product, and they themselves may have practices they're not set up to incorporate the technology, so have actually been referring patients over to me to help them with certain cases, specific patients.
When you hear patients excited about the technology, how do you hear that buzz? What are the things that they say?
Patients that come in say, we hear you do that custom lens, that specialized lens that's just for me, unique to me. So that customization, specialization, patients really appreciate that they're getting a truly custom treatment and a customized experience. And that's what they are coming in for.
Yeah,
So
that that's I love that. Now, when you were implementing this technology, was the RxSight team there with you?
the RxSight team was an excellent resource as I implemented technology in terms of both assisting both myself and the staff in helping determine our message out to patients, helping determine workflow, helping determine really how best to succeed with this new piece of technology and how best to succeed both internally in the office logistics as well as in the market.
Okay. And do you have any examples of some of the things that they did?
Well, when they came in the first few times for our treatments, they would come in to help us with patient flow and how best to organize their schedule to be able to accommodate these patients. Again, these are patients who are expecting a premium experience and a customized experience. So we didn't want them to get lost in a normal workday where they may be stuck waiting between patients and get forgotten about or just don't get the attention that they're expecting. So they helped us organize that. They helped us organize them both in the operating room environment to make sure these patients get just get organized, don't get lost in the system.
All right. Now, I'm sure you talk to doctors, other providers at meetings when you go there. And when you run into colleagues and they learn that you're doing the light adjustable lens and they say, "Boy, that just takes too long." What do you respond to them with?
My first answer, actually, when anybody asks, "Does it take too long? Doesn't it take you?" We do pretty good already, don't we? And honestly, my response is, we do pretty good. Pretty good is not our goals. Our goals should be better than pretty good. And to answer directly, it takes too long. I remind them there's nothing more soul crushing and ruins your day than an unhappy premium lens patient because that patient will just ruin your day. Your staff gets nervous every time the patient shows up on the schedule. They come in, they're unhappy, and it's just a negative effect on your mental psyche, your staff, and even in the waiting room if the patient continues on in the waiting room about how this premium product just didn't meet expectations or actually has led to a detriment in their lifestyle. And we just don't have that with the LAL. There are not unhappy patients. There just aren't. So that really changes the whole character of the practice that we don't dread seeing somebody because they're going to be unhappy.
Does your team get excited with the light adjustable lens?
To be honest, no, because it's such a routine at this point in our practice. We're 2 years in, and it's another patient. It's we see so many, and we do so many of them that it's kind of just our. All right, so we're here scheduled. We got the 1 o'clock, the 2:30, and the 3:30 coming in, and it's part of our routine now. We really don't. It doesn't stop to pause anymore. It's just part of the system.
Yeah. Okay. That's good. I mean, that you've turned something so amazing into something that they kind of feel like is um, you know normal.
Actually, the flip side I would say is we still do offer. I still do offer other premium lens technologies, and I offer those because not every patient is a candidate for the light adjustable lens. Small pupils don't have the patience to go through the adjustments, lives too far away. There are a couple of reasons that they can't get the light adjustable lens. And when we see those patients in the immediate post-op period, there's a bit of, oh no, is this patient going to be happy or not? There's actually a little bit more of a nervousness about seeing those patients than there is the light adjustable patients.
Now, tell me about when you run into colleagues and they're wondering, listen, Dr. Reddy, I'm thinking about implementing the light adjustable lens. What advice do you have for me?
Well, when they start, I say, well, you first find patients who understand what they're in for and what they're getting. The early patients need to understand why they're coming in for multiple visits compared to their friends and colleagues who might have had surgery, one post-op visit, and been done. So need to find patients who are interested and who get excited by technology.
I love that I love that you've got a novel approach to things and you're learning how to implement even more.
So no, it's been a wonderful technology. It really has. Like it takes any premium patient. There's a bit of occasionally there can be a bit of dread. Does this patient have halos? Does this patient have dysphotopsias? And those patients just sour your entire day. So I can honestly say this is the one product I haven't had any bad outcomes yet. With a few hundred in, and I haven't taken a single one out. That should speak for itself.